Hi, Dr. Goldman. How are you? First of all, we have to be grateful with you for being in the Colombian Urological Society annual meeting. It's very important for us to have a leadership of opinion in functional urology as you are. Welcome.
Thank you. Thank you for having me, and it's a pleasure to be here.
Okay. I have the first question for me. For resume, after we listen to your conference, is in which patients you don't offer or you change the alternative to don't give anticholinergics?
So I think we have to be careful with anticholinergics, particularly in the older patients. If we are able to give them a beta-3 agonist, that is my preference. However, sometimes because of insurance reasons or coverage, we can't. And if we can't, then we often give trospium or other medications that don't seem to have as much of an effect on brain function. We try as much as we can to never give immediate release oxybutynin, but certainly, and that goes for everybody, but the ones that we are most cautious on are the older, frail patients.
Okay, thank you very much. In this type of patient, what is the most important thing do you think that the urologists overlook?
So I think, if you really look at many medications, particularly the anticholinergics, by 6 months, many patients are not taking them. And so we are very quick to move to botulinum toxin, to neuromodulation. And I think a lot of urologists make a prescription and the patient doesn't come back and they forget about them. So I think it's very important to keep track of your patients. And medications, you should know within a month if it's helping. So have them come back at 6 weeks. And if it's not helping, either try another medicine or move on to something else.
Okay. And the last question that I have for you is, how is the balance of make an overtreatment in this type of patients and make an unnecessary exposure to the secondary sites in this type of patients with the anticholinergics?
So again, you have to be very careful. Many of these patients, particularly the older ones, are on other medications that have cholinergic activity, and you don't want to give them an overload of those things. So really, I think the smartest thing is don't forget about conservative treatments, pelvic floor physiotherapy. If you do medication, follow them closely. So if it helps and they don't have side effects, great. But if it doesn't, stop the medication and consider something else.
Okay, Dr. Goldman. It's very clear, I understand. And then we finalize. We are pressure your time being with us, and we hope you come back for another annual meeting.
I would love to. I'm waiting. Send me the invitation.
Okay.